right, today we're going to be making some custom orthotics for a patient. A lot of people ask what's the difference between a custom orthotic and something over the counter. You're going to see today that I make a mold of the patient's feet using plaster, and there's an appropriate position that you've put your foot in. I hold the foot in, so when we make the mold, it mimics what's called your neutral position. That is not necessarily the way that the foot positions when you stand on it. So in this patient in particular, we are actually going to make some accommodations in the orthotics as well. So I can actually draw on the bottom of the foot areas that I want to offload, so there's not as much pressure. And in this case, I'm making what are called metatarsal pads, and it's a great accommodation to take pressure off of the ball of the foot. And so the casting technique that I will be using is called, it's just plaster molding. And there are many different types of ways to make orthotics. Some practices will use a foam box. Other practices will use a pressure mat that they walk across that can create a computer generated image. This technique itself is the oldest, but it has also been shown in medical journals to be the most accurate way to make orthotic casts. And it's the most messy and the most time consuming, but it does tend to produce the best type of orthotic. So we're going to use two different layers of plaster, and I'm basically making the patient's own customized mold of their foot. And once this mold is made, we send it to our orthotic lab, and then they fabricate it based off of the specifications that I talk with the patient about on what kind of shoes and what their goals are for these orthotics. So once the plaster is on, we try to mold it to the foot very well, and then I tell the patient to completely relax their foot, and then I hold the foot and put it through range of motion until we find that neutral position that I was discussing. And then we hold that foot in that position with care taken to keep it in this position until it hardens. After it hardens and we send this mold off, they do convert it to a digital image. So at any point, if a patient needs to order another pair or has anything that needs to be modified, it is turned into a digital image. Typically in orthotic, the hard part will last you about 5 to 7 years, and then our feet change just like the rest of our bodies change. And so then it's time to get a new mold made at that time.